Hello, welcome back to Newsworld. You're on Newsroom Africa, Channel 405. Our next conversation is regarding mental health and particularly how under-resourced mental health in Nigeria and, well, professionals. Nigeria has one of the largest populations with mental health issues. Let's take a look at this documentary.
This guy's wearing a shackle, huh? Why is that?
Actually, the patient is said to be restless.
He's restless now.
Yeah.
Kò ṣe ká mọ̀ bá máa rìn káàkiri ìlú náà fi dé mọ́ wa lẹ́sẹ̀ àfi jókòó jẹ.
Títí oṣù márùn-ún tí àgádágodo ti wà lẹ́sẹ̀ mi tí n bá ti fi rìn mi máa ń dùn mí.
It's not good to human being. It's like bí kéèyàn wà nínú ọgbà ẹ̀wọ̀n. This is my child, all my family. I'm not happy.
She be somebody that she can help people before, but when her sickness starts, people run away from her.
I am a mother of a child with autism. They said I was a witch. If I touched him, maybe his condition would be worse.
Ènìyàn máa lọ kọ́ máa dún ní ilẹ̀ ẹlẹ́ ẹ̀jẹ̀ bá ti gbọ́ sáà ní pé sẹ́ni ń dán bí a ṣe ń lọ ìyá trace bí sẹ́ni yẹn yóò lè bá wọn tí wọ́n bá wà.
I believe say that psychiatric it will work for her that time, but there's no money to took her there.
It is not easy for an average Nigerian to afford mental health care services.
Well, that's just heartbreaking visuals to watch. And according to Human Rights Watch, thousands of patients with mental health issues are bound in chains and locked up in facilities across Nigeria where they are subjected to abuse. The rights groups say detention and violent treatment of patients are rife in some state-run clinics, Islamic rehabilitation centers, traditional healing homes and churches in the country. We now speak to one of the experts in this regard, Chief Udeji Ndubueze Jonas, who is a patron of all Nigerian Nationals in Diaspora South African Chapter. Chief, thank you for joining us on Newsworld, here on Newsroom Africa. I mean, we see this documentary and we see how patients who have mental health issues are being chained. And if I look at some of the statistics, obviously Nigeria being the 7th largest country in the world, 1 in 4 Nigerians that's around 50 million people, because there's a 200 million population, are suffering from some sort of mental health issue. And what gets more concerning about this is that there are only 150 registered psychiatrists to deal with a population of 200 million people. Why are those in need of mental health care being failed?
Good evening. It is actually very embarrassing what that is recently discovered that is happening in Nigeria. Unfortunately, we see that as institutional failure, where religious groups and the traditional healers had to take over because the health department has failed. But when I was in Nigeria, in the state or province called Abia State of Nigeria, where I lived, I was the public relation officer of Christian Association of Nigeria. So in one of my social community works, I do visit Abia State Psychiatric Hospital. And in that hospital, I saw that the mentally challenged people were well treated. There are cleaners, there is everything there in that institution. But unfortunately, Nigeria is not a nation where things are maintained. It continue to get dilapidated. Government doesn't step in. So it's unfortunate what is happening. And you see the length of time that it took before the government was able to discover what is happening.
Do you think now that the government has discovered what's happening, we're seeing these reports week in, week out of these places where patients suffering from mental health issues, the way they're being chained and the way they're being treated. Do you think now that these reports are coming to the surface, governments will take it a lot more serious?
Of course. Any government that cares for its citizen should be very worried at what is happening. Now that they were not much concerned and is now in the poor view of the entire world what is happening, I think they should step in if they really care. It's expected that the health minister and other institutions that are concerned should be held to account by the government. And the federal government should actually, what is their budget for health? Apart from the mental health hospitals. So generally, the state of health in Nigeria is not something to talk about.
Yeah. I mean, has government responded to this? Have they given reasons for why this has happened, how they've allowed this to happen?
They have not said much about that because in Nigeria, you hardly find any mental health care center. As I said, the one that I knew of years back is the one, I would even say that that's the only one in how many provinces that we have. And there are a lot of mentally unstable people working all around the street, unlike here that the government take full responsibility. We understand the issue of life as the many and what happened, but that of Nigeria, the life as the many is just little compared to what is happening in Nigeria.
Okay, you mentioned life as a many and government's role in that in South Africa. Let's look at regulations in Nigeria. Do they have mental health regulations or mental health laws? Are these laws maybe archaic, if they do have any?
In Nigeria, every law is there, but what we do not have is implementation of those laws. Nigeria is more or less a very lawless country where the laws are there, but the people in power do not implement those laws. Yeah.
Right. And Chief Udeji, maybe also let's talk about why mental health, why it's such a problem in Nigeria right now. We're saying 1 in 4 Nigerians suffer from mental health. That's about 50 million of a 200 million population. Is it also a lot to do with stigma? We know that there is a stigma attached to mental health. It's something that we don't want to talk about. It's something that people don't view as an illness. Do you think that it has a lot to do with stigma? And also, we look at these cases now recently of these camps, I wouldn't call them camps, but places where patients are being chained and being mistreated. And families obviously have allowed this to happen because maybe families can't cope with this. Families aren't aware of these mental health issues. Do you think stigma has a lot to do with this?
Yes, I think there is exaggerated, because Nigeria is 200 million people. So it's exaggerated to say that about 1 out of every 4 has a mental issue.
You saying it's exaggerated?
Yeah, that's what I feel. It's exaggerated. Okay. But however, the number that we know that are suffering this, because I don't know where they got their data from.
They do statistics.
The statistics. I don't know how they received, how they come about with that number. But as a Nigerian who is regularly home, like now I got back last Tuesday, that's when I got back from Nigeria. So,
Chief Udeji, would you agree
Yes.
that there are not enough trained health professionals in Nigeria? There are not enough trained health professionals or professionals that are trained to deal with mental illness in Nigeria? Psychiatrists, psychologists?
There are a lot of professionals, but unfortunately, Nigeria is one of the countries that has a lot of brain drain, where the professionals prefer to go outside, where their skills are more valued than paid. So you don't have a lot of them practicing in Nigeria because of the poor condition of things. One, the facilities. Two, the payments, the salaries for such profession. They get better pay elsewhere. They just fly out of the country. Just like in this country, you have a lot of Nigerian medical doctors all over. So apart from the mental health care, generally the Nigerian professionals or experts in various fields, they travel out of Nigeria where they get more pay, see equipment and technological equipments that they can use to practice what they have learned.
Well, there you have it. Chief Udeji joining us in studio, who is a patron of Nigerian Nationals in South Africa, breaking it down for us. Obviously, you mentioned the brain drain and exodus of Nigerian professionals, and maybe also perhaps the reason why there's a shortage of trained professionals to deal with the mental health crisis happening in Nigeria, and maybe government's response to this and their responsibility, funding, and ways to retain professionals in the country. Thank you for joining us, Chief Udeji. Newsworld's going to take a short break.